Hi, I'm Dr. Jessica Orchard. I'm a cardiac screening researcher at the University of Sydney and Centenary Institute. We're discussing all things about cardiac health and endurance training, and you're listening to the Physical Performance Show.
And the winner is...
Failure is not an option.
I've had my ups and my downs.
I think it's an absolutely breakthrough experience.
Welcome to the Physical Performance Show, the show designed to inspire the pursuit of your physical best performance. I'm your host, Brad Beer. Listen in as we delve into how the world's top physical performers achieve their success, as well as the highs, the lows, and the journey of getting there. Let's get ready, set, let's go. Welcome to episode 347 of the Physical Performance Show, brought to you by Polar's stunning new generation running watches, the Polar Pacer and the Polar Pacer Pro, and Say Sky's high-performance running apparel. I'm Brad Beer, sports and exercise physiotherapist by trade and training and founder of Pogo Physio. Each week, we'll bring you the latest and greatest information and inspiration designed to help you perform at your physical best. Of course, we do this across a range of our different episodes, interest editions, coaches' corners, learnings catch-up episodes, featured performers, and our ever-popular expert editions. And off the back of last week's expert edition, featuring APA-titled sports and exercise physiotherapist Jess Cunningham, who shared around her recent publication, Pop, When Sport Brings Us to Our Knees, a wonderful book that chronicles the tales of athletes recovering from ACL traumatic knee injuries. You are in for some more learnings this week as we bring you an all-important conversation, one that we have been looking to have for many years here on the Physical Performance Show, and that is about the cardiac health of endurance athletes. And today's guest, Dr. Jessica Orchard, sheds light on many of the key topics that endurance athletes want to know about their cardiac health. By way of bio, Dr. Jessica Orchard is a sports cardiology and screening researcher, a Heart Foundation Post-doctoral Fellow, and the Associate Editor of the British Journal of Sports Medicine. Alongside this is an adjunct senior lecturer at the University of Sydney, widely published across cardiac screening in athletes. Now, ahead of this episode, there were many listener questions that flowed through for Jessica to answer. We could have spent hours answering the many questions that came through. However, with time constraints, that was not possible. But get ready with your pen and paper. Here is this all-important expert edition, Cardiac Health for the Endurance Athlete with Dr. Jessica Orchard. Dr. Jessica Orchard, welcome to the Physical Performance Show.
Thanks so much for having me. Great to be here, Brad.
This has been a topic on the must-explore list, really, for the last 6 or 7 years of this show's existence. And our paths have crossed online, and I'm so grateful that they have. You are one busy academic, and you've just taken on a role there at the British Journal of Sports Medicine, perhaps my favourite clinical journal, as the Associate Editor. So congratulations, and no doubt your days are very full.
Thanks so much. Yeah, great to be on board at BJSM. It's a great journal.
Jess, we're talking about cardiac health and endurance training. This show predominantly has endurance sports roots, triathletes, distance runners, track and field, swimmers. One thing that comes up often is the effect of exercise on our cardiac health and function. There's lots of beliefs out there. I'm sure many are not accurate, and this is an amazing opportunity to hear from someone like yourself who's so well versed in the world of cardiac function and exercise. So should we maybe just strip it back to the start and just explore what effects endurance training can have on the heart to begin with?
Yeah, absolutely. Great place to start. And I think you need to begin any conversation like this by remembering that athletes on average have excellent health outcomes. Endurance sport particularly, but all sport results in greater longevity, less heart failure, fewer coronary events. And so it's really important to bear that in mind with whatever you say next. So regular exercise does promote structural, functional and electrical remodelling of the heart. And that's often referred to as athlete's heart. And most of the time that's benign. So importantly, how much your heart adapts does depend on a number of factors, predominantly including sex, genetics, but also exercise dose and intensity. So people doing endurance sport particularly tend to do a lot more than perhaps others. And so they often have the greatest degree of those sort of athletes' heart remodeling features. Things like competitive cycling, rowing, running, cross-country skiing definitely has the greatest impact on cardiac structure, function and electrophysiology. Whether that's a problem or not is a different matter. But fundamentally, those changes are to ensure that there's basically enough cardiac output to provide oxygen to muscles when you're exercising. So it results in an increase in cardiac volume to pump more blood to your muscles when you need it. It is interesting to note that women do appear to be affected differently, and that's something where we need more data. And one of the specific aims of our research is to look a bit more at female athletes and see if we can learn about how that might be different. And it's also important to know that genetics do play a role as well in cardiac response to exercise. The
genetic side of it, is that like any training adaptation, there's varying levels of response to the same stimulus, responders, non-responders. Is that what you're referring to there with the genetic contribution?
Yeah, absolutely can be. So you can look at 3 endurance athletes with similar training loads, and if you image their heart, you might find slightly different levels of exercise-induced cardiac remodeling in all of them. And it's just like a lot of things, we don't always know exactly what does it, but some genetic causes can be contributing factors to why some people might have bigger changes, especially when combined with the environment of a lot of exercise.
You mentioned there's 3 categories: the structural, the functional, and the electrophysiological, or the electrical side of the heart's function. On the structural side, Jess, what are some of the structural changes that can result in that athlete's heart?
So that's where you're really talking about changes in cardiac chamber size, bigger, and wall thickness as well. And those changes are such that the heart can fill and eject a larger volume during exercise, and that's referred to as stroke volume. And that can also include changes to cardiac size and mass. So mass of an athlete's heart can be 35% greater, and cardiac volumes can be 60 to 80% greater. And I've heard some experts describe it as the heart's almost fighting for space in the chest cavity in some athletes. It gets so big.
Wow. And from memory, going back to my exercise science days, Jess, it's the left ventricle that is the one that hypertrophies in an athletic heart. Is that right?
I think you can get changes on both sides with different effects. Certainly it's important to look at the left ventricle as well, but others would say don't forget the right as well. So certainly can be changes in both.
In both. The electrical changes, is that signalling things like lowered resting heart rate? What sort of things might we see there?
Yeah, so that's the most common. You can see easily sort of 60% of athletes have what is called sinus bradycardia, which is defined as a heart rate below 60, a resting heart rate. And even a proportion of especially cyclists and things can have a resting heart rate in the 30s. So the heart's almost half asleep, you might say, except when it needs to be, and then it certainly does wake up. And so we have specific athlete ECG interpretation criteria now, and that defines a normal heart rate in an athlete as being anything above 30 beats per minute. So that goes to show how low they will allow as normal because it's so common.
When did that criteria come out? Is that a new advent or?
Yeah, it's been really developed over the last sort of 10 to 15 years, gradual improvements. The most recent criteria are called the international criteria, and co-lead author is Professor John Dresner, who's current editor-in-chief of the British Journal of Sports Medicine, together with Sanjay Sharma from the UK. Basically, over a period of 10 years, they've just got more and more accurate as we've got more and more data to sort of better define some features as being normal in athletes.
It's great, though, that there's that criteria because I think a few athletes can get puzzled looks at times from when their data's analysed amongst an unathletic population and there's these changes. Jess, so you've mentioned some of the positive effects which we'd expect from engaging in exercise. Cardiac issues for the endurance athlete, they probably disproportionately get airtime when events happen. At a triathlon, someone has a a cardiac event and perhaps, they don't survive, or a sudden death of someone on a sporting pitch. What are the common cardiac issues that endurance athletes may experience or can occur?
Yeah, that's a really good question. And so I guess we have to reiterate that we are probably talking about a fairly small subset of athletes, but certainly not to be ignored. And so one of the most common issues that can arise is arrhythmias or heart rhythm problems, and that's something that is often noticed during exercise or during quite high intensity exercise. It may present as a funny feeling or a fast heart rate or a flutter. And certainly there is a clear association between high volumes of intense exercise and arrhythmias such as atrial fibrillation. So atrial fibrillation is a really interesting one because it's a bit of a U-shaped curve. So in terms of its association with exercise. So certainly we know that too little exercise is a big risk factor for AF. Somewhere in the middle, it absolutely reduces your risk. But then once you get up to the super high intensity levels of training, it does raise your risk again. Having said that, it doesn't always raise your risk of having a stroke in the same way for endurance athletes as it might do for the less active population. So a lot of the times arrhythmias are not the end of the world for an endurance athlete, and a bit more in the category of an annoyance. That said, it's super important to correctly and accurately diagnose what it is before you can say that. So one of the most important things you can do if you are experiencing anything that could be a bit like an arrhythmia is to see if you can document it yourself. And there are so many devices out there now where you can take a smartphone ECG or an ECG on your watch, or even a heart rate monitor is of some help. ECG is a little bit better, and the more that you can go into a consult with a bit of a picture of what's going on, the better that will guide the next steps, and the quicker you'll get an answer probably. So
do a little bit of, where possible, preparation ahead of a perhaps medical appointment with a practitioner to hopefully fast track the diagnosis if there is any. And that's really interesting about the U-shaped curve with the risk for atrial fibrillation. You mentioned there, Jess, super high intensity levels of exercise. There may not be a direct answer here, but is it the hours of exposure? So like an endurance athlete, there's often that, thinking simply the 80-20 type approach, 80% aerobic activity, 20% at high intensity. It's a fairly common intensity distribution paradigm. Is it the high intensity work that may put athletes at heightened risk, or is it the hours of exposure of the aerobic work, or do scientists like yourself just not know?
Well, I've heard it described as it's sort of time multiplied by intensity. Although to an extent, I don't think we have a perfect answer. And one of the really important studies that's going on at the moment is an international study called the Pro at Heart study. And that's got centres in Belgium and Australia. It's the largest study in the world to assess the health effects of high-level endurance exercise on elite endurance athletes over a long term. So it's a prospective study where athletes are followed over a long time and assessed really comprehensively over a period of years. And so that's led by some absolute really biggest names in the field, Professor Hein Heidbuchel in Belgium and Professor Andre Lagersh in Melbourne. And so studies like that are really important to see if we can learn a bit more about exactly what those drivers are and potentially make adjustments.
Yeah, so more work to be done.
Of course.
Of course. But no, that's great. Any other common cardiac issues for the endurance athlete, Jess? So atrial fibrillation, we've mentioned there. What else? Yeah,
atrial flutter. I certainly think other sort of rhythm issues that can come up. Sometimes they're called ectopic beats, sometimes extra beats, just funny feelings that are often benign. You certainly can get bad arrhythmias. And as I said, it's super important to get a correct and accurate diagnosis about what you're talking about there. And then other things that can occur really depend on age. And so in those aged under 35, the less common but really very serious conditions that can be associated with sudden cardiac arrest and death, we must stress they are rare, but those sorts of things are more often a cause of problems under the age of 35. And that's things like cardiomyopathies, long QT, Brugada, Wolff-Parkinson-White. And those are the sort of things you look at when you're doing cardiac screening of elite athletes. Whereas over the age of 35, one of the most common problems you can have is coronary artery problems. And that's something you can look at by looking at risk factors and modifiable risk factors like cholesterol, hypertension, smoking, and things like that. And they're sort of often assessed through heart health checks by your GP in Australia.
So 2 categories of screening, which we'll dive into screening in a moment a bit deeper, but the sub 35-year-old person or athlete, as you mentioned, and then greater than 35 years of age, you'd be potentially screening for different things.
Yes.
Jess, I guess it sits likely under the category of an arrhythmia, but something that I know I've observed quite a few high-level triathletes, Olympic champion experienced this. One of our Australian greats, there's been a few, but supraventricular tachycardia, SVT. Anything specifically that you've got to share around SVT from your experience and knowledge?
Yeah, absolutely. So that's one of those really sort of common arrhythmias, and most of the time it's hopefully not terrible and can be treated. But super important to figure out whether it's SVT or VT. And that's where documenting it with any kind of ECG, even a portable one, even a single lead, can be enormously helpful in that. And we've written up a case series of athletes who have had certain arrhythmias and been able to document them themselves with these portable electronic devices. And so, number one, figure out if it is SVT. Don't assume that it is just because you think it might be. Number two, if it is, and if it starts to become problematic, there are ways it can be treated through ablation, so electrophysiology studies and things like that. And I guess number three, it's possibly a little bit more common in male athletes. So a lot of these things we do find are much more common in male athletes, like atrial fibrillation as well, which is actually a type of SVT, a subtype, I guess. A supraventricular meaning above the ventricles.
Yeah, so I guess in summary, anything else for the common cardiac issues that you'd like to mention, Jess, or mainly the arrhythmias to keep in mind?
Look, the most common things are arrhythmias, and most of the time they're not too bad, but you need to be accurately diagnosed and treated. And then once you're over 35, there are other things that can happen that are more what we would call sort of acquired or coronary artery disease. And that's really important if you've got any symptoms to follow them up. And then under 35, there are a few even less common conditions, and it's what you look for in screening. But I guess the message is always, if you've got symptoms or something that you're worried about or a bad family history, it's really worth seeing someone to get that checked out.
If in doubt, get it checked out. It's certainly not something that anyone should, play around with, for want of a better phrase, right? It's get it. If something's not quite right, get it checked. If for nothing else than in reassurance, it's worth it. You touched on the word screening there. I know this is a big area for you with your work and research, and we're not too long ago awarded a grant to really explore cardiology screening for athletes that weren't able to access services. It's probably not well understood. What does it even mean? So maybe we strip it right back. Like, what is cardiac screening? Who's it for? How's it done? And why does it matter?
Yeah, that's a great question. And so when we talk about cardiac screening, as I said, there's a really big difference for those aged under 35 and what you might look for versus those who are older than 35. So at the elite level, many sports in Australia and internationally do conduct really well-run cardiac screening programs for elite athletes. And that process aims to look for those rare conditions associated with sudden cardiac death, like cardiomyopathies, long QT syndrome, and things like that. So basically, part of the reason they're looking for those is also a good work health and safety argument. So that's why a lot of these recommendations are focused on elite athletes. So that's for people who are, in the course of their work, being asked to push themselves, their bodies and their hearts to the absolute maximum. So these tests generally include a personal and family history and a physical examination, which will be things like pulse, blood pressure, things like that. And a 12-lead ECG, a resting 12-lead ECG, which looks at the heart's electrical activity and involves putting sticky dots on the chest to measure. It's a painless test, and it measures the heart's electrical activity over a short period. And so there are occasional sports like cycling and soccer at the elite level that also require an echocardiogram, which is like an ultrasound of the heart, but that's not always done in other sports. For a few reasons. So it's important to understand that, like any screening test, it's not perfect and cannot capture every abnormality. And so there are some good examples, such as Christian Eriksen, the Danish soccer player. He'd been screened, including by very well-run centres, and nothing was found, and yet he still had a cardiac arrest. So his case still really raises a very important part of screening, and that is that it should be accompanied by cardiac emergency preparation. And so because he was fortunate to have really quick CPR and defibrillation, his life was saved, and he's gone on to be fitted with an internal cardiac defibrillator, I believe, and looking at return to play. So that emergency side of it at the professional level is really, really important as well. Turning to people who are aged over 35, that's really you're looking for different things because the rate of coronary disease goes up far more in that age group. And so screening in that age group is focused on looking for risk factors such as smoking, high blood pressure, cholesterol, things like that. And that's really where you go and see your GP for a heart health check. And in certain age groups, that is funded by Medicare. However, it's really important to emphasise that anyone who's got something about their heart that's worrying them, or who has had a family member who's had a cardiac arrest under the age of 40, or any symptoms like fainting or collapse during exercise, they're really good reasons to go and get yourself checked out no matter what age.
Gosh, that's important information. Jess, an obvious question would be, who performs these screenings? Is it a general practitioner, a sports physician? Yeah, where do people go? So for the recreational athlete out there, what would be your advice on who to turn to for a screening?
So I guess the average recreational athlete, if they don't have a problem and they've not recently just started a new program of exercise, may not need screening at all. So it's important to decide, is there something that is worrying you, which is sort of following up a symptom, or do you need screening due to your level of competition? So if you need it due to your level of competition, it may well be organised by your sport, and it may be that the history and physical examination side of it is done by a sports physician. Depends on the sport, they're all a bit different. And then your ECG needs to be interpreted by someone with expertise in athlete ECGs, which may be a sports physician or a sports cardiologist. If you're over the age of 35 and looking to have your risk factors checked, the best place to start is at your GP, and they'll refer you on possibly to a cardiologist if you've got any further concerns. But if you do get to a point where you've got something that looks a bit tricky, or you're lucky enough to have access or knowledge of a sports cardiologist, they are a very, very useful resource if you need it and if you need that level. Not for your average screening if you're going fine and just want to have a brief check, but if you've got something that looks a little bit more difficult, that's absolutely a really useful place to go.
Is it fair to say if someone's not being bothered by any notable cardiac concerns, that they don't necessarily need to engage with a screening? It's only if they've got symptoms, or if they are in that category of this is your job, you're doing it because it's OHS. Is it that black and white?
Perhaps, and as I say, with that caveat about age. So it's a good idea for people who are sort of aged 45 plus to go and get those risk factors checked at their GP, because even really fit people can still have issues that are worth looking at. For those who don't have a problem, who are younger than that and are not required to by their sport, I would agree with you. And unless you've got a really bad family history or something that's worrying you under that age, it's probably fine.
You're listening to Dr. Jessica Orchard on this expert edition discussing cardiac health for the endurance athlete. Support for today's show comes from Polar. Polar believe that the most important thing you can do is listen to your heart. Uncanny considering today's expert edition topic. What Polar does helps to improve the health, fitness and quality of millions of lives around the world, and this is what drives them. But what is driving you? If you are interested in the next step in your fitness and health tracking, do take a moment to check out our friends at polar.com. If you're looking for the latest in running watches, they have the all-new Polar Pacer range. For multi-sport, it's the Vantage V2. Or if you're getting off the beaten track and need a premium outdoor GPS watch, look no further than the stunning and tough GridX Pro watches. However, if you would like to get the most out of your training and racing, take a beat to grab the gold standard in heart rate monitors, the Polar H10. Or for an even more flexible heart rate monitor, the Verity Sense, which also tracks your heart rate for swimming. Polar's range starts at $129, but what's most important is that whatever you are doing, do it with heart. Polar.com. Support for today's show also comes from Say Sky. Say Sky was founded in 2013 by Lars Pedersen, a former pro windsurfer who decided to take the relaxed and fun attitude of that sport into the running world. This attitude, together with Say Sky's focus on high performance and quality garments, has become Say Sky's mission in a time when the market has been dulled by some of the giants in the running apparel industry. Say Sky also support up-and-coming athletes, those athletes as well who we call everyday heroes, people who are juggling work, friends and family, but still have the time and dedication to train hard and have fun along the way. This is the mentality that Say Sky celebrate, and Say Sky have generously offered up 15% off their high-performance running apparel by using the code TPPS15. So jump over and check out the wonderful running apparel from Say Sky. For now, let's jump back with this week's Expert Edition guest, Dr. Jessica Orchard, discussing cardiac health for the endurance athlete. Jess, you've mentioned the term risks numerous times. There's obviously lifestyle risk factors like you've mentioned, smoking. Some factors can't be controlled. There can be genetic contribution, like I guess cholesterol and blood pressure. But is there anything that you'd share around the nuances of certain sports? Like, are there higher risks with certain sports or certain undertakings that people should be aware of?
Yeah, that's a really good question. And I guess the first thing is risks of what? So if you're talking about the risk of actual sudden cardiac death, the research shows that there are some sports that are particularly high risk, and basketball in the US is one, with the highest risk being Division 1, so the higher competitive level, highest risks in male athletes and higher risk in Black African American players in terms of the number of those who die. If you're talking about risks for sort of arrhythmias like AF, we know that endurance athletes are at higher risk for those arrhythmias. And then if you're talking about risk, it's important to remember the risk of not exercising is a really important one to weigh against it. So certainly none of this is meant to sort of suggest that you shouldn't be exercising. But, you know, in those small number of cases where there's a serious problem, there are certain things that are slightly higher risk than others. So it must be a balanced consideration there.
Yeah, interesting. Makes sense intuitively. And I know you've pointed out to me that, say in triathlon, a swim, bike, run, that the swim leg is associated with higher risk of cardiac events. That seems interesting because I guess of the three disciplines, perhaps the cardiac demand might be the lowest in the swim in general terms. But is there any reason for that, or anything you'd say to the triathletes out there without turning them off their sport?
Yeah, so nothing I say should turn you off your sport. That's number one.
Yeah, of course.
And it probably won't, because you have to be pretty determined. So that was a recent study that was published of US triathlon races from 1985 to 2016, and there were 135 sudden deaths during those races, with the average age of the victims 47 years old and 85% male. So just like a lot of studies showing men are at higher risk. And yes, 90 of those 135 deaths occurred in the swim segment, and the autopsy showed that coronary disease or cardiomyopathy was the most common cause, although some are still unexplained. There's a couple of comments I'd make. One is that identifying and resuscitating someone who's having an arrest in the water is probably much harder. And so if you're running and you suddenly stop and collapse, the chance that someone sees you, helps you and gets a defib to you is a bit higher. That's me just having a bit of a guess there. But certainly water sports, it can be a lot harder to get to you in time. And so I suspect that that's part of it.
Yeah, that's a good point. And yeah, I mean, every death matters, of course. 135 across those years. But as you say, it's got to be a balanced consideration of risks. The risks of not engaging in exercise versus these,
100%.
these relatively isolated cases, but obviously each case does matter. Jess, we have been very heavily inundated with interest in you featuring on the show with listener questions coming through. Can I throw a few your way? But before we open up for some Q&A from our listener questions, I'm going to pop you through some challenging questions. And the first is, what would Dr. Jessica Orchard's top 3 tips be to the endurance athlete to maintain cardiac health?
Excellent question, Brad. And so tip number 1, don't stop exercising. So even if you've got a stress fracture or an injury that means perhaps you can't run for 2 months, it's really important to keep your heart health up through something like cross-training, swimming, cycling. You might still lose some running fitness for your leg muscles, but your cardiac will be maintained. And one of my colleagues, Andre Lagersh, often says, your heart can't tell what shoes you're wearing, but it can feel the effects, which is a great line. I think he's a pretty handy athlete himself, having run a sub 2.5 hour marathon. So tip number 2, if you've got a symptom that's worrying you, get it checked. So just because you're very fit doesn't mean you can't have a problem. So if you've got an arrhythmia, fainting, bad family history, crushing chest pain, feeling of a sudden loss of a cylinder, anything like that, go get it checked. Third tip, continue to test for COVID if you've got symptoms. Certainly it's getting to be less of an issue now that isolation isn't required, but it really is important to know for your maximum performance, you still need to know if you've got COVID and rest up if you've got symptoms. There's a really great return to sport article that's just been published this year in the Journal of Science and Medicine in Sport, led by Dr. David Hughes at the Australian Institute of Sport, together with a great team of co-authors, and it provides a really good graduated return to sport post-COVID. And also in general terms, stay home when sick. There's a lot of reasons to think that respiratory illness can actually contribute to poor cardiovascular outcomes. You're probably not going to gain a huge amount by training when you're sick. So back it off for a couple of days if you are.
And that's a question that so often gets thrown up. Should the athlete continue to exercise when they've got symptoms? How much is okay? How much is not? And there's varying, I guess, guidelines thrown out there, but I guess there's no hard and fast rule, but it's trying to be wise. And maybe you're on the side of being conservative.
Yeah, definitely. And also ask yourself, is it super important? If you're just going for a sort of a light training run, do you need to keep going if it's really making you feel unwell? How important is it? Are you playing in a grand final or you're just doing run number 5 of the week? I think that's part of the question as well. And if you are in an event or something, are you going to be able to do your best? Sometimes you just have to be patient with yourself and say, I just don't think I can do it today. The same way you might say it if you've got a hamstring strain. There's a level you can push through and a level you probably can't or shouldn't.
So there's a level you can push through and a level you probably can't or probably shouldn't. And just to recap those 3 top tips, because they were wonderful, don't stop exercising, even if you're injured. Find a way to keep some cardiac activity. Get any symptoms checked and continue to test and monitor for COVID if you have symptoms. Obviously so pertinent in the post-COVID world. But just going back to the unwell athlete and exercise, is there, from your knowledge and expertise, Jess, any truth in the idea that exercising when you are unwell can, in brackets or quotes, damage the heart, create permanent sort of impairments on the heart?
I'm not sure that that's super well established, but that said, if you're feeling like what you're doing is really hard and you're feeling awful and you're unwell, it's probably a good reason to stop as well. If you know you're unwell, pushing through a high level, you'll feel it if you're doing damage, I would think. Especially with COVID, the data that we've got at the moment shows that most people who've got some big sort of heart-related involvement from COVID, it's not silent. You'll get symptoms and you should get them checked. So I think a lot of it goes back to if you've got some quite bad symptoms that you're noticing that are unusual and you're unwell, it's probably a good sign your body's giving you to back it off at that point.
You mentioned that great resource, the Return to Sport guidelines by Dr. David Hughes and his colleagues. Do you know, out of interest, Jess, is that open access, that journal?
That particular paper is. I was refreshing my memory of it this morning, and I can supply you with a link,
Oh, thank you. We'll pop that up in the show notes because that would be a really helpful resource. And just on signs and symptoms, cardiac-wise, Jess, for COVID, and I guess maybe we'd throw long COVID in there as well. What should athletes be monitoring or looking out for?
For symptoms of COVID, you really, as we've always discussed in the media, it's often sore throat, runny nose, cough, could be sort of fatigue or muscle pain generally. Sometimes it's almost a feeling like you could easily just lie down and have a nap as an unusual symptom. So mostly respiratory symptoms though. The sort of cough, sore throat, runny nose type.
Yeah.
Usually it begins with people thinking they don't have COVID. There's almost no one who thinks they've got COVID.
One thing I've heard mentioned numerous times, and even myself with my exposure to it, my exercising heart rate was quite elevated. And just, doing our normal Tuesday ride and reaching levels of maximum heart rate on an effort that I would not typically reach. And I remember going, okay, that's unusual. I'm just going to back it off. And just took it steady for a little while and things seem to normalise.
Yeah, and I think that can happen post-vaccine as well. Some people like to watch their heart rate quite commonly. Some cricketers I know of especially, and they notice it goes up by just 10 beats a minute, and that's just after a vaccine and not being unwell. So definitely COVID can affect the heart, and I agree with you that that's not uncommon to hear heart rate go up.
Dr. Jess, we could record listener questions for quite a period of time, probably an hour or two. Obviously, we aren't able to answer every question that's come through. I've documented a few down for us on our discussion guide. Zoe asks, Dr. Jess, what are the warning signs for women? Zoe has read that women's cardiovascular issues and symptoms may be subtly different compared to men. And the second part of her question is, should athletes be taking CoQ10?
So that's a really good point about whether women experience different symptoms. And what you might have read about is women with a heart attack symptoms. And so those symptoms, it still might be chest pain, but it's quite common for those symptoms to be a bit more subtle. So perhaps neck, jaw, upper belly discomfort, nausea, sweating, fatigue, and there certainly can also be some different risk factors as well. But when we talk about those symptoms, that's symptoms of a heart attack. So that's sort of a narrowing of an artery. If you're talking about symptoms of an arrhythmia, they may well be very similar for men and women. So you feel like your heart's fluttering or something like that. So it's important to distinguish between the two in that question, but absolutely right. And one of the biggest things is if you feel like something's wrong, make sure you follow it up. And so if you feel like you're not being listened to, perhaps try someone else. If you feel like something that is wrong, that's often the best guide and really important there. CoQ10, I don't think there's any single drug or supplement that everyone should take. It's always something that some people might need, some people won't. CoQ10 or coenzyme Q10 is something that's found in cell mitochondria and is required in aerobic respiration. There is some evidence it can be useful in treating arrhythmias, such as premature ventricular contractions, and it has been shown in humans to be an antioxidant and may be useful. So for some people it might be useful. But also remember that it is available as dietary CoQ10 in meat and fish, vegetable oil and avocado. So those dietary sources, certainly think everyone should have those. But in terms of whether you need it as a supplement, I would say only if it's been recommended to you.
Thank you, Jess. Jess, Heidi, who I know is a health practitioner herself, asks, and a keen endurance athlete, and I know you've touched on this already to a degree, changes in morphology of the heart in response to chronic endurance exercise, plasticity of the heart post-chronic exercise to relative detraining in comparison to previous load. Are there detrimental structural changes to chronic cardio exercise that reach a point of no return in relation to plasticity when detraining? I guess there's a fair bit in that question. But anything that sort of springs to mind? Definitely
a very big question there. And I think the answer is you can get to a stage where those changes don't reverse. And it's certainly true that if you are doing a huge amount of exercise over a long period, the changes that can happen to your heart will go beyond health in some cases, and you may end up with some changes that are not great and don't resolve with detraining. So I do think it's important to listen to your body up to a point. And one of the great books I've read recently is called The Haywire Heart, which is by Chris Case, Lennon Zinn and John Mandrola, all really good athletes themselves, but looking at the limits of exercise and what you can do to protect your heart before you possibly have gone too far. So interestingly, John Mandrola, who's one of those authors, he's, as well as being a really good endurance athlete, he is a cardiac electrophysiologist and cardiologist as well. So a real expert in heart rhythm problems and what you can do about it. But it's a great book, and it does certainly put a case for don't go too hard, as you might at some point then get an issue and have to dial it back. And some issues resolve, some don't. It goes through the evidence though, and that's really interesting reading for those who might want to look at that issue.
Thank you for recommending that resource, The Haywire Heart. We'll pop that up in the show notes, but I think I'll be making a purchase of that book myself. Jess, Jack asks, what to make of ectopic heartbeats? Are they more common with bradycardia?
Definitely can be. And like a lot of things, can be just a bit of an annoyance. You do have to know that they're ectopics before you can decide that they're just benign and an annoyance. Sometimes a lot of ectopics can look a bit like or feel a bit like atrial fibrillation. You can never just tell by the feel usually. So number one is to decide whether they really are ectopics. And if so, absolutely quite common to see them in those with bradycardia, but not always much of a problem unless you're getting a lot of them.
Thanks, Jess. Shannon asks, in a similar vein, I guess, talking about arrhythmias, Shannon's heard of athletes developing AF, which you've referenced already today. How to prevent it developing? I guess that's the golden question.
Yeah, that's a really, really good question. So as we've talked about, the risks are higher in sort of more endurance athletes. They're also probably higher in men, if I'm honest. So those two things are part of the picture. You can't really change too easily some of your sex and genetics, but perhaps there's a level, and this book, The Haywire Heart, makes this point. Perhaps you can make sure you're not going to the level of overtraining, and so train perhaps smarter, not harder, and there's some strategies you can use for that. If it's something that's worrying you, you can certainly talk to your GP or cardiologist about it. But also remember, as we said, the U-shaped curve, and not exercising is far bigger problem for atrial fibrillation than exercising too much, I think.
No, thank you. Angus asks, obviously it's a big topic, what sort of increase in cardiac issues has Jessica observed post-COVID/COVID vaccines? So I guess quantifying your observations or perhaps the data or the science.
Yeah, it's a really interesting question. And so when we're talking not just about athletes, but about the whole population, Australia's a really interesting case study because you can look at the different years where we had no COVID and no respiratory deaths. So in 2020 and 2021, when we had the vaccine as well, but still not much COVID, we had what we call negative excess deaths. So fewer deaths and fewer cardiac deaths than normal. But then in 2022, now that we've got sort of COVID circulating a lot and we've got our respiratory back, we've got flu back and those things, we now have more excess deaths, including cardiovascular deaths. So the Australian data really shows that sort of more COVID and more respiratory in the population at a population level does lead to more deaths and more cardiac deaths as part of it. So I think if you're talking about the overall picture, that's sort of where it stands. Definitely there are some people who've had cardiac issues both as a result of COVID and as a result of the COVID vaccine. Those are small numbers, and overwhelmingly the vaccine has been of benefit, but there's no doubt that that has been an issue. And as has been written, the vaccine-related issues such as myocarditis, pericarditis is most common in young men after the second dose of an mRNA, so Pfizer or Moderna vaccine.
Yeah, so there's been obviously episodes, that's undeniable. I know of several patients in my physiotherapy caseload that have typically been young men who have developed some post-vaccine complications. But then obviously there's also the other side, which is the ongoing complications from COVID itself. So it's in some ways a bit of a muddied water that we're all, I guess, navigating on the other side of it. and will be for some time.
Yeah, absolutely. I guess the important point to make with myocarditis in athletes is that for those who've had it, most do recover quickly and completely. And so that's really good news. So some of the data that we've got is from a great registry in the US called the ORCA Registry of College Athletes. And so that's giving us some really encouraging data.
Jess, you have been very generous with your time and expertise. Every guest of the show gets issued 2 set questions, and here they come. The first, if Dr. Jessica Orchard could issue listeners with one single piece of advice to help them perform at their physical best, what would your single piece of advice be?
So my piece of advice would be to gradually build up your kilometres and training loads over many years. It's really an investment that's well worth making, both for your performance, your heart, and for preventing injury. So load management for performance in straight line sports like running and swimming and cycling has been really well known for a lot of years, and it's now so much more easy to measure it and to do that really well. And it's starting to happen a lot more now in the team sports as well. So definitely gradually build up and play the long game.
Play the long game. Gosh, that's amazing. What sound advice and physical challenge for the week. Dr. Jessica, what would your physical challenge to the listener be?
So instead of telling people to go out and run the longest, hardest thing they've ever done, it's a little bit the opposite. So to ask yourself the question, are you being optimal in your recording of your training? Don't do an unusual week. Monitor your training and try and keep it as consistent as you can. So building your heart by training gradually makes you healthier, and it helps you to look after it as well.
I guess it ties in with your top piece of advice in many ways. Well thought out from a great academic brain. Well done. Dr. Jessica, you are accessible with your output academically in the field over on Twitter. That's where I first connected with you, at Jessica J. Orchard. Is there anywhere else that you'd like to direct people to keep up to date with the work that you're doing, or perhaps if they wanted to engage with you further?
Yeah, absolutely. I've got a website at the University of Sydney, which I can give you for the show notes. Otherwise, Twitter's a really good way to get in touch.
Yeah, look, thank you. We'll pop that up in the show notes, physicalperformanceshow.com. Dr. Jessica, we really do appreciate you shedding some light on this such important topic. And I know for one, I've gotten a lot out of it. So thank you for stopping by.
Thanks so much. Pleasure to be on.
So there you have it, another episode of the Physical Performance Show. And I trust and I know that you found Jessica's sharings today very helpful. Now, it's likely that someone in your training circles would benefit from the information that Dr. Jessica has shared today. So do take a moment to pass on this all-important expert edition. If you'd like to engage with Dr. Jessica Orchard more, you can find Jessica, as mentioned, over at Jessica J. Orchard on Twitter. Now, we're also tagging up Dr. Jessica Orchard's handles in our show notes alongside those wonderful resources that Jessica mentioned. The Haywire Heart book, which I will be purchasing a copy of, and the Return to Exercise Post-COVID-19 guidelines, as Jessica mentioned, authored by Dr. David Hughes and his team. So you'll find all that over at physicalperformanceshow.com. Massive thanks to today's show partners, Polar and SaySky, for supporting the show, and also our show patrons. Thank you for your practical support. Podcasts are free to enjoy, however, they are not free to produce, and your practical support goes such a long way. If you'd like to support production of the show, you can do so from just $5 per month by jumping over to Physical Performance Show and clicking on the Patreon tab. In return, we'll grant you complimentary access to all of our upcoming live stream events and, of course, our back catalogue of live stream events featuring the likes of Dr. Stephen Seiler, Dr. Shona Halson, Rinnie McGregor, and most recently, Rory Darkins, who delivered a wonderful live stream on athlete health and wellbeing and sports psychology. A big thanks to the great folk who make this show possible each and every week: Daryl Misson, audio engineering, Susan Wilkin, show administration, Matthew Walding, show graphic design, and Milan Borrow, videography. If you are yet to follow the channel over on YouTube, jump across there. You can also now view video recordings of the episodes. If you are an endurance athlete struggling with bone, tendon, or joint-related concerns, Pogo Physio's online 45-minute telehealth consultations can be an ideal vehicle to help get you back to your physical best. You can jump over to pogophysio.com.au/telehealth, and there you can schedule your 45-minute online consultation with myself or any of the Pogo Physio team. If you have any feedback regarding the show, perhaps an upcoming guest recommendation, then you can reach me over on the socials at Brad_beer. Now, coming up on the Physica Performance Show, we have all the highs, lows and learnings to continue coming your way. Next week, we hear from recently retired Great British triathlete Non Stanford on the highs, lows and many learnings from her career. Following that, we have some wonderful expert editions coming your way also. So until next week, keep pursuing your physical best performance. I'm Brad Beer and this has been the Physica Performance Show.